Good evening, everyone. We are pleased to welcome today to all of you for this question and answer session. And I hope that whatever worry, whatever trouble, whatever health challenges you are facing, कुछ भी परेशान जो कर रहा है आपको आज आपको उसका आंसर मिल जाए. And I hope all of you get answers here today. So we also have Mrs. Vandana Ahuja and Mrs. Seema Manikot, devoted Imana health coaches who have been actively organizing wellness camps and guiding individuals toward better health for several years. Both are bringing deep compassion and practical experience to their work, helping countless people embrace a natural and balanced lifestyle. And also, they are Pune Wellness groups, I think, from the Pune Wellness Imana Camp group. So let us take a moment to appreciate their continued efforts in spreading the message of holistic living through the Imana community. And now, it's an honor for me to introduce Dr. Arun Sharma, the founder director of the International Institute of Mahayoga and Natural Hygiene, which is called IMANA. He comes from a remarkable family legacy. His grandfather, Acharya Lakshman Sharma, is also known as father of nature cure in India. And his father, Professor Ganesh Sharma, dedicated his life to teaching the philosophy of natural health. Now, building on this foundation, Dr. Sharma has earned his doctorate in natural hygiene and has spent over 4 decades helping thousands of people across the world to heal naturally through their timeless principle of Mahayoga and natural hygiene without the use of medicines. Now, he is also recognized with an national and international honors, including International Gandhi Award and title the Man of the Year. So, and he is also continuing to inspire and lead this life with a mission to empower individuals and communities to live in the harmony with nature. So please please join me in welcoming Dr. Arun Sharma again. Guruji, over to you.
Namaste, everybody. It is my pleasure to join you all in introducing natural health science as a most recognized system of health. And I'm also happy to see that my second son, Muhammad Al Farouk, is also joining us in this session. And to begin with, I would like all of you to understand that natural health science is a recognized system today in all over the world. Today, we have scientific proofs of so many cases of cancer, starting from asthma, diabetes, and all the alphabets covered in different diseases. We don't declare that we cure diseases, but because patients come with records of their diagnosis, you make use of that in order to recognize different situations, stages of disease cured, and they are coming back to normal health. This recognition of names has become necessary for more people to appreciate our work. As otherwise, in our category, in our understanding, there is only one thing: health and health. Lower level of health and improved level of health. That's all we care about. Names of disease is not our style of treating people. Names of disease have made a stand in the world to create fear in people. I have this disease, that disease. All those names make people be afraid, and that they have this dangerous disease, incurable disease. Of course, every disease is incurable in the history of medicine. Whereas we do not recognize that there is a disease, and so we cannot even say that we have cured diabetes, we have cured cancer, we have cured any disease. That is where the problem comes, because we are compared with medical science, and there are several systems of medicine. Allopathy is the most popular system, but there are so many other systems. Homeopathy and acupuncture and acupressure, name it, there are so many systems which claim that they have got recorded success in curing so many diseases. Whereas we go by their reports that they have got diagnosed by medical system, and they are later on treated through natural health science, and again they are checked medically and proved that they are free from those problems. As far as we are concerned, we don't check that. They get it checked from medical people, and then they report that they have got this cured. We are having to use that record in order to compare ourselves, in order to stand in the platform of science. We are having to accept those things just to prove ourselves such as a most useful systems. Otherwise, we don't need that. A person is not experiencing any more problem after following natural, healthy lifestyle. It's only a lifestyle. In our system, it is not that it is so simple that we don't have details to explain. There is so much details to explain that it can go for years together. We are having to compare ourselves with medical system and medical treatment, that we had to declare a course for 3 months, 1 year, 3 years, and 5 years. All that we have to do just to compare. People are getting training. Kumar, தண்ணி வேணும். So they can go through stages of training and deal with all the problems that medical people are dealing, and declare patients cured from different diseases. So, in order to explain how we go about the sources from which we are made. Our body is made up of 5 elements. And whatever our body is made up of, we are using only those elements to repair that. Our diagnosis is deficiency in the earth element, deficiency in the sun element, water element, all those things. We make a change in their lifestyle to include those elements in order to improve health, overall health. When they improve health, it is like a dark room and a room with lights. That's all. In dark room, we are not able to see things. As we keep on improving light, increasing light, we are able to see things. In the same way, in life of individuals, we are having to introduce these elements little by little from gross to subtler element and more subtle elements. That is why we need training to understand how to introduce these elements gradually in a manner that they do not have any suffering. Now I would like to ask, ask my team to bring out some important examples of cases which we have treated and which were called diabetes, which were called asthma, which were called with different names. I will invite Vandana to give out some examples and Seema also to say some things like that. And in that manner, we will be able to show examples from different people.
Sure. Thank you, Guruji, for starting off with this Zoom meeting. It is always a pleasure to have you on such meetings and see you here. So I would actually like to narrate my own example. So since childhood, I have been an asthma patient, and I had always an inhaler in my purse, and I couldn't walk for even a minute, couldn't run for a minute. The moment I used to run, I had huge breathing problems, and it was difficult for me to even stand. But since 2022, I've been following this lifestyle, and I got associated with Dr. Arun Sharma ji and pursued the lifestyle. And magically, I have been able to reverse all my health conditions. So I also was on high BP medication for about 10 years. And so the doctors always say that lifestyle disorders like high BP and diabetes are incurable, and you will have to keep taking medicines for the same all your life. But to be honest, by following this natural health science lifestyle, I was able to reverse all of them. So I am myself an example of how this lifestyle has really helped us. We have received a lot of questions from people, and we will be taking up questions now for Dr. Arun Sharma ji to answer them one by one. My co-hosts Gauri ji and Seema ji will be helping me in asking these questions to Dr. Arun Sharma ji. So the first question goes like this. We have a question from somebody from Jamshedpur, and the question is, my brother became quite thin, face looks shrinking, bone can be counted in body. So what are the natural diet ways to increase balanced weight? Guruji, the question is for you.
Okay. We don't try to increase weight, we try to improve health.
Yes.
When we try to improve health, The guidelines are common to all. Ample exercise, adequate rest, positive food, positive thoughts, things like that. When we say ample exercise, people who are showing bones, their bones will be covered with flesh, adequate flesh. It doesn't mean that a person who is showing bones is unhealthy. We just have to improve exercise and the absorption of nutrition will be better. He will get better hunger, he will get better digestion, all those things will improve simultaneously. So it is not only exercise, but influencing the body with all the 5 elements. Person should have confidence, should believe in natural health science to certain extent that he will adopt, get benefits by adopting all these rules. No matter how much one follows natural health science, one may still be not improving because he doesn't have so much belief. How does it make a difference? It makes a big difference. A person who believes that it's going to benefit him will benefit much more than person who doesn't believe in it. Vishwasa Shastra Siddhante Bharanyasa Paratmani Vairahityamitetat Trayam Manasa Bheshajam. That means the entire treatment begins from the mind. Vishwasa Shastra Siddhante mantras, all the principles explained in Shastras, you have to believe in that. Bharanyasa Paratmani. Also, you have to have a trust in God, that God is working within you. Bhairahityamitetat. Absolutely no doubt and no fear. If you entertain fear and doubt, then you are not going to improve no matter how much you follow correctly all the system. Trayam manasa bheshajam. Treatment begins from the mind. All the treatment, for 3 guidelines we are given. Vishwasa Shastra Siddhante, the principles of the Shastras, we have to believe in that. Bharanyasa Paratmani, we have to trust in God. That means God means nature. You have to trust in nature that's working to improve your health. Definition for health, they come later. Which are the definition for good health? Also that we understand, a person may be lean and thin, but he may be very healthy. A person may have flesh and everything, but still he may not be healthy. All that comes from understanding completely the principles of the Shastras. And implicit faith in God. Whatever God is doing good. If you have that, you will have the happiness, and automatically your flesh will be added wherever it's needed. A person who is trying to eat plenty of protein and fat and everything, he's still not putting on weight because he doesn't believe and he is not happy. A person who is happy, even with very little nutrition, he gets very good health structure. That's what we have to understand. Over to you.
Guruji, now the next question. I'm following, this is from Bangalore, a 45-year-old person, following whole food plant-based lifestyle for 5 years, almost 90% of the time. Recently affected with duodenum ulcer for the last 2 months. Fruits and raw veggies consumption came down and I couldn't digest further. So, following Ayurvedic medicine along with cooked food, banana and coconut water, with symptoms of irritation in stomach and nausea. Also, this person has done a few naturopathy treatments for a week in naturopathy hospital. How to improve digestion through nature cure and heal the ulcer.
First and foremost, that he needs his happiness. And then second thing he needs is an occupation. If he doesn't have any occupation or a goal in life, no matter how much diet he follows, how much exercise he follows, he is not going to improve. Those are the important guidelines. And somebody has to work with him periodically and to monitor his progress. Then he will see remarkable improvement in his health. He must have an interest in some occupation. What does he want to be in life? That he has to decide. And once he decides that, then he can see that goal is there and he will work towards that goal and he will see putting on better weight and structure. That's all my reply.
Thank you, Guruji. The third question is from somebody who's 61-year-old. I had breast cancer since couple of years, and only recently I took step towards healing. Got done with mastectomy and then started chemotherapy. After first round of chemo, my body struggled to take the effects of medicine. It was traumatic. What can I do to ease the process and still heal fully from the cancer?
As long as she understands that chemotherapy is not the answer, she is not going to solve her problems. Since she has stopped chemotherapy, she has to understand that there will be side effects of whatever she did. Every wrong thing that you do in your life, you will have to face the consequences, that is, effects of your treatment. It's not side effect, it's the main effect. Whatever you are doing, if you are doing anything wrong, the chemotherapy sends rays of light which is not healthy. So consequences have got to be faced. If you understand that this is the consequence of your wrong steps, then you will go through it very pleasantly, happily, by following a healthy lifestyle. And problems can be solved sooner with acceptance. Okay?
Thank you for the answer, Guruji. The next question is by somebody who is a 42-year-old, and he says he's got swelling His fasting sugar levels are 200 and there is stone in the pancreas. Can anything be done to resolve these issues?
Definitely. All these issues can be resolved by only accepting the consequences of medical treatment. Accepting that I did this wrong, that's a consequence of this mistake. So once you accept it, then you are able to solve the problems faster without much suffering. Natural health process will involve in eliminating even the ill effects of whatever medicines you took or medical treatment that you took. Once you accept it, it'll go faster. That's all.
Now, Guruji, there's another person, a 31-year-old from Jaipur. I'm facing chronic acne from the last 15 years. I tried allopathy, homeopathy, Ayurvedic medicine, but no cure till now. Also, my monthly periods have become irregular for the past 2 years after marriage. I have connected with Gauri Agarwal, that is our other co host here, who is a student of Guruji for the last 3 months. This acne problem affects my mental health also now. So many treatments, but no results anywhere. Face looks bad. I request, please, please help me.
She is already being helped by Gauri Agarwal. All that she has to do is to patiently go through all the symptoms that come in consequence of healthy lifestyle. So let her follow healthy lifestyle, expose her body to sunlight, do more pranayama. All this will solve the problems very soon. Okay.
Another question is from Poland. Is 35-year-old. Can we live normally and digest properly if gallbladder was removed due to gallstones?
Well, gallbladder is supposed to be an extra part to store bile whenever there is extra pressure in the liver. But it is not a solution to remove the gallbladder. Whatever mistake we have done, we have to face the consequences. Yes, there is natural health solution for every problem, but you have to understand that natural health only improves the health, overall health, but does not solve immediate, does not give immediate resolution for so many problems. Over the period of few years, that person can overcome consequences for having removed the gallbladder. Only healthy lifestyle, natural healthy lifestyle will eventually solve her problems. Thank you.
Right. Thanks for that insight, Guruji. So the person has to learn the natural healthy lifestyle to be able to overcome this problems, the issues being faced because of removing the gallbladder. So a 47-year-old from Bangalore wants to know, is B12 and vitamin D supplement important to be taken if levels are low?
They can be substituted by natural means by taking regular sun baths, taking herbal juices, by taking pranayama, doing deep breathing exercise. These are different means to solve all those problems. Deficiency in vitamins can be fulfilled naturally. That person needs monitoring, needs some guide to monitor the observation of discipline and progress little by little.
Thank you, Guruji,
Okay.
for that. Yeah, it's true. Just a change of food habits and lifestyle can easily compensate for B12 and vitamin D. So, as per what you say, Guruji, there are nobody would ever needs to have supplements, right?
Right.
Yeah, the next question, Guruji, a 62-year-old from Bangalore. In my left hand muscles, there is a kind of pain shifting different areas in different hand muscles only. In different areas in the left hand, the pain keeps shifting in different muscles. So something very unusual.
Well, whatever happens for good. The pain is an indication of the life taking over cure. In order to solve the problem, he has to go to a stricter diet regime and regular sun bath, pranayama, and exercise. Exercise, of course, both hands equally, but use the left hand a little more in order to solve the problem. And have confidence that he can solve it. Details can be had by approaching a health coach, natural health coach. That details can be regulated weekly or bi-weekly by following a table and marking how much you followed and how much is the result. All that can be done.
Yes, it's important to be able to monitor everything. That is when, we are able to know that, oh, are we following or not following, right? So the next question is from somebody who's aged 52. He or she is saying, how to control the sugar?
You don't control the sugar. You control eating habits. Eat natural foods and it can generate the needed sugar for your body. If you are eating unnatural foods, eating white sugar or sweets made of white sugar, then you are inviting problems. All the sugar that we need, we can get from fruits. And the starch is also converted into sugar when we chew the food thoroughly in the mouth, and the conversion takes place in the mouth instead of loading the liver and other places. So that's the only thing. There are detailed instructions as to how to monitor diet regulation. When you are taking fruits, take one kind of fruit. Don't take mixed fruits. When you're taking starch, chew it thoroughly in the mouth and do the conversion in the mouth before you send it to the liver. All these instructions are given in our classes, and our helpers can give detailed instructions wherever necessary.
Very
There are
true.
several.
Yes, it is very easy to control the sugar levels just by very simple changes in lifestyle. Many of us who had high sugar levels or borderline sugar levels have been able to reverse all of it just by changing and following a natural, healthy lifestyle. So, and it is actually Diwali time, and this is the time of the year when everyone has overdose of sugary sweets. So, definitely try and monitor your intake. And if you happen to have a lot of sugar and sweets and unhealthy food, try to fast for a day the very next day.
Guruji, I would like to tell about one type 1 diabetes patient, 5-year-old child. She came to me 3.5 months back. When she came to me, she had around 13 HbA1c. And now for the last 3 months, she's off all insulin injections. And just day before yesterday, we got her HbA1c tested, and it has come down to 7.2 or 7.5 something. So just 3 months she's off all insulins. It's only uh, your methods of lifestyle and food habits. And so this is how easy it is uh, to get our sugar level. So it's still not in the right parameters, but it's improving.
Great. Nice to know.
Okay, so the next question is by a 26-year-old from Pune, and the question is how to cure eczema. The person has been following Ayurvedic treatment, decoctions, and panchakarma, but even after that, the eczema has flared up even more.
Eczema is asthma of the skin. Eczema of the lungs, asthma of the lungs is eczema of the skin. It's a breathing problem. The skin has also the process of breathing, which we don't allow by applying artificial materials over the skin. So we have to do some runnings, we have to do some more application for the skin so that the pores in the skin open up, so the skin also breathes better. And the treatment is the same for no matter what disease we are suffering from. You have to positive food, ample exercise, adequate rest, and positive thinking. How does thinking come in this? Because our thoughts entertain wrong material for wrong information for influencing fear in yourself. So we have to understand all that and adopt a total healthy lifestyle with ample exercise and all that. And then this problem will go away.
I think Seema ji. Okay, I'll ask the next question.
Okay.
Yeah, so this question is from Hyderabad. A 37-year-old person is asked, are fistula fissures curable?
Absolutely. We have to use toner and hold the water inside for longer time. We could give more hydrotherapy like hip bath and things like that, and use what you call wet packs for the lower abdomen. All this hydrotherapy application and added efforts to hold the breath after exhaling, and simultaneously visualizing that you are removing, pulling the intestine upwards, visualizing and suggesting that you are pulling the intestine upwards, eventually helps in the cure of fistula. Breathe out and hold the breath, and simultaneously visualize that you are pulling your intestine upwards. These are the ways by which you can cure all those problems.
That's a
Definitely.
great tip, Guruji. Thanks for that. I hope it is helpful and useful for the person who asked the question. The next one is by a 50-year-old from Delhi. The question goes like this. My father is having Parkinson and is on Syndopa medication. And because of that, I think he has started to constipate. Is there any help that can be given to him?
First and foremost, along with medication, we don't follow nature cure. Natural health science helps only for persons who gives up all the medicines and then follows natural healthy lifestyle. That has to be understood. If you are following, taking some medicines, simultaneously following natural health science, the ill effects of medicine will be even more dangerous, because it acts more dangerously in bodies which are purer. Imagine if there is a drop of ink in your dress, it will be glaringly visible compared to Vandana's dress or my dress. If there is an ink falling on my shirt, it will not be visible. So, if on a purer body, the medicines will act very vigorously and it will have more ill effects. So, a person should not follow any other systems if he follows natural health science.
Okay. So, if anyone wants to learn a natural and a healthy lifestyle, we have organized a 7-day retreat, which is near Lonavala between Mumbai and Pune. So, if anyone is interested to join this retreat or camp, this is going to be held in November from 17th of November to 23rd of November. I'm currently displaying the flyer of the upcoming camp near Lonavala. The contact number is mentioned over here, 9322132648. For any queries or inquiries, you can contact this number.
Great.
We will proceed with the rest of the questions now. So there is a
Yeah, the next question is from a 66-year-old. Actually, someone has asked to talk in English, I mean Hindi also. Should we ask in both?
yeah, we can speak in Hindi.
Yeah, the question is how to strengthen bones. Doctor said, I'm heading towards arthritis. एक किसी का क्वेश्चन है क्या 66 ईयर का है गोवा के इंसान है उन्होंने पूछा कि हड्डियों को मजबूत कैसा बनाना है एंड डॉक्टर्स ने बताया कि उनको आर्थराइटिस का होने का संभावना है तो गुरुजी बताइए
पहले तो डर निकालना है। जो डर है इसके बारे में, ये हो जाएगा वो हो जाएगा, वो डर निकालना है। उसके बाद हमें क्या करना है कि जो हेल्थ को बढ़ाने के लिए, स्वास्थ्य को बढ़ाने के लिए तरीके हैं, वो उन तरीकों को अपनाना है। प्राकृतिक तरीकों को अपनाते वक्त और कोई दवाइयों का इस्तेमाल नहीं करना है। कोई एक सिस्टम को विश्वास करके उसमें पूरी तरह से प्रैक्टिस करना है। इससे इसके अलावा और कुछ नहीं है। जो भी जो भी बीमारियों का नाम है उससे डर हटाना है और हमें ये विश्वास करना है कि शास्त्र में जो लिखा है वो हमारे हमारे अच्छाई के लिए लिखा है। और भगवान के ऊपर या कुदरत के ऊपर पूरी तरह से विश्वास करना है, भरोसा उसी के ऊपर करना है। जो दुनिया का जो जितने भी जानवर हैं वो तो कभी किसी दवाई के हॉस्पिटल में नहीं जाते हैं। जो पालतू कुत्ते हैं, पालतू जानवर है, उनको ले जाते हैं दवाइयों के डॉक्टरों के पास। उनका हालत तो और भी खराब होता है। लेकिन जो जंगल में रहते हैं जानवर वो कभी किसी डॉक्टर के पास नहीं जाते हैं, कोई दवाई नहीं लेते हैं, फिर भी ठीक हो जाते हैं। इसलिए हमें भी यही विश्वास करना है कि कुदरत के जरिए पूरी तरह से हम लोग ठीक हो सकते हैं। विश्वास शास्त्र सिद्धांते भरन्यास परात्मनि भैराहित्यमित्येतत् त्रयम मानस भेषजम। इलाज शुरू होता मन से। कैसे शुरू होता है? शास्त्रों में जो लिखा है बातें वो ठीक ठीक है ऐसे विश्वास करना चाहिए। भरोसा करना है भगवान के ऊपर और डर बिल्कुल नहीं रखना है। डर हटाना है तो सब कुछ ठीक हो सकता है। थैंक यू।
So the next question is by a 71-year-old from Thane. The question is, the person is suffering from insomnia, thyroid, blood sugar issues, as well as extreme tiredness. जिन्होंने ये क्वेश्चन पूछा है उन्हें नींद नहीं आती, उन्हें थायराइड और ब्लड शुगर के प्रॉब्लम्स हैं और उन्हें बहुत थकावट भी होती है। इसका क्या सल्यूशन हो सकता है?
ये जो सॉल्यूशंस हैं वो बीमारियों के नाम से नहीं जाते हैं। स्वास्थ्य को बढ़ाने से सब बीमारियां दूर हो जाती हैं। बीमारी का मतलब है स्वास्थ्य की कमी। प्राकृतिक चिकित्सा में सिर्फ जीवन शैली को देखते हैं। प्राकृतिक जीवन शैली को अपनाने से स्वास्थ्य और भी बढ़ जाता है और अच्छा हो जाता है। जब स्वास्थ्य अच्छा हो जाता है तो सब किस्म के जो बीमारियां हैं वो दूर हो जाते हैं। बस सिंपल आंसर है। जैसे भी जो जो बीमारियां उसका नाम पहले भूल जाओ, उनका लिस्ट बनाओ, उसको जला दो और अब ये सोचो कि हमें स्वास्थ्य बढ़ाना है। स्वास्थ्य को बढ़ाने के लिए स्वास्थ्य जो हमारे जीवन शैली है और स्वस्थ होना चाहिए, प्राकृतिक मार्ग से चलना चाहिए। ये करने से हमारा स्वास्थ्य जैसे जैसे बढ़ जाता है बीमारियां दूर हो जाती हैं।
Next question is from somebody from Bangalore, 34-year-old. Recently in Kerala, there were deaths related to brain-eating amoeba. Nature Cure believes in terrain theory rather than the germ theory. How do we explain this?
I couldn't get the question properly. फिर एक बार।
Recently in Kerala, there were deaths related to brain-eating amoeba. Nature Cure believes in terrain theory rather than the germ theory. How do we explain this?
We explain that there is only one entity in life which we call health. If you improve health, disease goes away. Disease is only lowered level of health. And when the solution is so simple, we don't have to worry about this disease or that disease. Amoeba or whatever problems they are posing, they are all problems of lowered level of health. If we improve the health level, all the problems vanish without any amoeba question or question of anything else. When you improve overall health, your all the elements in the body becomes available for repair. They become more available when you follow healthy lifestyle, natural healthy lifestyle. That's all there is to it. Guidelines can be given individually if they contact any of our health coaches, giving details of the person's age and place of life, lifestyle. सारा डिटेल्स हमको लेना होता है पहले. We have to collect all the details of healthy lifestyle or whatever lifestyle they are following and introduce changes in a manner that they are able to follow better healthy lifestyle. And once they do it, they will see results coming wonderfully.
Okay. So the next question is by a 68-year-old, and he's just written high BP. So probably he needs help to reverse his high BP condition.
Lifestyle changes include ample exercise, adequate rest, positive food, positive thoughts, and most importantly, guidelines regarding relaxation, change of thoughts, change of approach to life. These are guidelines which every natural health coach can give by following weekly progress. We give weekly charts for them to follow, and when we see that they have not followed certain guidelines, then we make sure that they follow this, and eventually they will see improvement magically. Thank you.
Thank you, Guruji, for that. It's so true. We can reverse. Everybody knows BP is a lifestyle disease. Unfortunately, they are not informed that you need to change the lifestyle for a disease that has happened due to lifestyle. So, yeah. And now the next question, Guruji, a 39-year-old from Jaipur, Agra. Jaipur and Agra. Well, my health is good. I need Guruji's guidance on family planning. Is it okay in life not to have a child? My husband is not willing to have a child. He is 40 years old and I am 39 years old. Can I please have your personal consultation on this topic?
Yeah, this calls for personal consultation, really, but it's because you have brought the question in public. The general answer that we will give is both husband and wife should want the same goal. If the husband doesn't want children and the wife wants children, it doesn't work like that. Both have got to decide in the same goal. And another thing is, family planning can be done only just by not planning as to which are the days the menstruation comes. There are certain plans like that when you will not get a child. You will not have consumption. Those are the different plans which are not, which cannot be assured. In spite of all that planning, people do consume and then they have child. When they both do not want it, they have to find out methods by which they will satisfy their what you call passion without having intercourse.
Okay. Next question is from USA, 65-year-old person. How often should we do abdominal wet packs and how to do it in cold winters? It feels cold in cooler weather.
Just by exposing that part to direct air, is you're almost doing a cold wet pack. Cold wet pack can be given along with hot foot bath. When you are giving hot foot bath, applying cold wet pack around the belly will not be troublesome, will not be disturbing. Such persons should expose their belly to sunlight and heat their body overall and give hot foot bath to the feet and simultaneously apply cold pack around the belly.
Yes. So if someone is feeling cold, dipping your feet in hot water bucket really helps a lot. And then it is easy to do an abdominal cold wet pack as well. So yes, that's a great suggestion. The next question is by a 73-year-old suffering from osteoarthritis in both the legs and gastric problems. Now improved and not on medication for the last 8 months. Okay.
There is no question about it. They have improved.
Yeah, he's mentioned that he has improved now and he had osteoarthritis in both the legs and gastric problems. So any more suggestions that will help him in these problems?
Most important suggestion is improve breathing exercise. Increase the duration of breathing exercise, number of times that you do. Holding the breath after exhaling, that helps a lot. That's the only suggestion that we could give. He's already feeling improvement and let
Guruji,
him keep it up.
Guruji, he has also written that he is not on any medications right now, but he has undergone some naturopathy treatments, looks like. And but he is not very clear about natural lifestyle details. So probably we should tell him to join one of our camps. This is what he
Yeah,
wrote in the, I mean,
sure.
s- yes,
Online
Guruji. And the
courses
next
are also
question,
available.
yes,
Online
online courses
courses
are
are
also.
also available.
Yes, and
Okay.
I think the next announcement for online courses will be in December, Vandana. When is it going to be? November or
Yes,
December, right?
they should start from January next year. One batch is already in progress, and the next batch should start from January.
Yeah, so maybe he can join one of the camps that's going to happen, and or he can join the online courses. Yes, Guruji, the next question is from a 58-year-old from Chandigarh. There is a lot of pain in my feet, my shoulder pains. Blood reports show autoimmune rheumatoid arthritis. My ESR is high, around 35, and HSCRP is 3.7, and RA factor is 130. I am on nature cure diet for almost more than 6 months, but my inflammation is not decreasing. I'm not taking any medicines right now. I want to heal my body with nature cure. So, Guruji, any tips for him?
We have to understand what kind of nature cure diet is he taking, what other treatment lifestyle he is doing. We have to see that, and if there is need for correction or improvement, we can do that. Without knowing what he is following, we cannot understand where he is going wrong. Simply by saying that I am following nature cure lifestyle or something, that doesn't solve all the problems. Okay.
Yes, Guruji, you're right. It's very important. Many people tell that one of the patients here told, I'm following 90%, yet I'm not finding any difference. But what is 90%? Like sometimes you tell Guruji the story of someone not having salad at all, and they say, I'm following 90%. So it's so important to know what is your 90% and what do you define as 90%. So if you're not following it properly, of course, the results will not be as desired. Yes, Guruji, now we can throw up the uh, questions based on whatever questions have been asked here in the chat, or
Yes, we are going to unmute someone on the Zoom meeting to ask their question live to Guruji. So, Gopal Soni is there?
Yes, I am. हाँ मैं हूँ.
जी, आप अपना क्वेश्चन पूछ सकते हैं गुरुजी को.
जी, मेरे भतीजे को आप सुन पा रहे हैं ना?
हाँ जी, सुन पा रहे हैं, सुन पा रहे हैं.
जी, मेरे भतीजे को टंग का कैंसर डिटेक्ट हुआ है और उसके लिम्फ नोड में कैंसर बताया गया. पहले आयुर्वेदिक ट्रीटमेंट लिया और अभी एक लवन चिकित्सा कहते हैं वो कर रहे हैं और इसके अलावा आयुर्वेदिक कुछ दवाइयाँ चालू है, गौमूत्र चालू है, शिवाम्बू चालू है.
आपकी आवाज थोड़ी कम आ
उसके
रही
गले
है.
का जो जी आप सुन पा रहे हैं?
हाँ जी.
आप ठीक आ रही है?
हाँ, बेटर है, बोलिए.
हाँ, उसके उसके गले का जो हाँ उसके गले का जो पहले जो गांठ थी वो विजिबल नहीं थी, अब काफी बढ़ गई है. तो इसमें हम कुछ कर सकते हैं क्या?
क्या बढ़ गया है? गले का प्रॉब्लम?
गले में कैंसर की गांठ है और जीभ का कैंसर है.
तो क्या कर रहे हैं इसके लिए?
इसके लिए इसके लिए अभी आयुर्वेदिक और लवण चिकित्सा, गौमूत्र और स्वमूत्र ये सब चालू है.
इसके साथ हमारा सिस्टम नहीं चल सकता है.
अच्छा.
इधर यू एकदम सारे जो भी आप फॉलो कर रहे हैं बंद करके ये हमारा सिस्टम
जी
शुरू करना है, तो आप अलग चिट्ठी लिखिए, पूरा अपना लाइफस्टाइल लिखिए, फिर फॉर्म भेजेंगे आपको, वो भर
जी
के भेज देंगे तो गाइडलाइंस बिल मिलेगा आपको.
ठीक है, ठीक है. मुझे किससे संपर्क करना होगा या मुझसे कोई संपर्क कर पाएंगे?
9@gmail.com वहाँ लिखेंगे.
जी मैं सुन नहीं पाया.
महायोगा99@gmail.com को लिखेंगे, आपको जवाब
जी
मिल
जी
जाएगा.
जी 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 धन्यवाद.
थैंक यू.
अर्चना जी, आप अपना क्वेश्चन पूछ सकती हैं.
गुरुजी आप इंडिया में कैंप कब करेंगे अगला? हम बहुत
अभी
बेसब्री से
नवंबर में अनाउंस किया है। तो मैं तो ऑनलाइन आ जाऊंगा, मैं पर्सनली नहीं आऊंगा। जब पर्सनली आने की तैयारी हो जाएगी तो मैं आ जाऊंगा, पहले से बता दूंगा।
ओके गुरुजी, हम सब वेट कर रहे हैं आपकी।
थैंक यू।
परिमल शाह जी, आप क्वेश्चन पूछ सकते हैं।
गुरुजी, आप ग्रॉस से सटल और सटल से सटलर जाने की बात कर रहे हैं, तो मेरा एक सवाल है कि आत्मा या सोल से कोई सटल है या नहीं है?
ये कहा गया है, आकाशाद वायु वायोरग्नि अग्नेरापः अद्य पृथ्वी पृथिव्योरौषधयः औषधिभ्यो अन्नम अन्नाद भूतानि, ऐसे कहा गया है। और सटलर एलिमेंट्स के लिए क्या कहा गया? आकाश से ऊपर क्या चीज है? मन, बुद्धि और अहंकार। अहंकार जिसको बोलते हैं, वो थिंकिंग दैट यू आर योर बॉडी, इससे शुरू होता है ये प्रॉब्लम सारे। अहंकार से ऊपर जाने के लिए यू हैव टू मेडिटेट एंड फाइंड आउट दैट यू आर नॉट दिस बॉडी। वो स्टेज जाने के लिए प्रैक्टिस चाहिए, करते करते हो जाएगा। उसमें सारे प्रॉब्लम्स आप सफ़र नहीं करेंगे।
आलोक जी, आप अपना क्वेश्चन पूछ सकते हैं।
प्रणाम गुरुजी। हाँ, मेरा ये क्वेश्चन था कि क्या नेचर का ट्रीटमेंट किसी को दे सकते हैं जो कोमा में हो?
सुना ही नहीं दिया।
Louder, talk louder.
प्रणाम गुरुजी, मेरा ये क्वेश्चन था कि कोई अगर कोमा में हो तो उनको नेचर का ट्रीटमेंट दे सकता है?
नेचर क्योर का ही दे सकते हैं, और कुछ नहीं दे सकते।
और उनके रिवाइवल के चांसेस होते हैं कोमा से भी?
हाँ, तो उनको धूप में लिटाओ, सर छाए में रखो, हवा लगने दो शरीर में, तो धीरे धीरे क्या हो जाएगा, फिर वो अपने स्वास्थ्य में वापस आ जाएंगे वो।
धन्यवाद।
किशोर धूमल जी, आप क्वेश्चन पूछ सकते हैं।
नेचुरल लाइफस्टाइल फॉलो कर रहा हूँ। हशीमोटो ऑटो इम्यून है बोल के पता चला है, तो उसके लिए क्या कर सकता हूँ?
किसके लिए?
ऑटो इम्यून, हशीमोटो, हाइपोथायराइडिज्म, ऑटो इम्यून।
अलग अलग बीमारियों का अलग अलग इलाज नहीं होता है। सारे
तो
बीमारियों को हम पहचानते हैं कि
नेचुरल लाइफस्टाइल
स्वास्थ्य
ऑलरेडी
की
फॉलो
कमी।
कर रहा हूँ मैं।
क्या?
होल
फिर
फूड
बोलिए।
प्लांट बेस्ड नेचुरल लाइफस्टाइल ऑलरेडी फॉलो कर रहा हूँ।
हाँ हाँ, तो नेचुरल लाइफस्टाइल में इम्पोर्टेंट पार्ट अभी समझ में नहीं आया आपको। इम्पोर्टेंट पार्ट यह है कि हम कोई बीमारी का जो है ना, शरीर के साथ जोड़ते नहीं हैं। मन, बुद्धि, अहंकार ऐसे जाते हैं हम लोग। जो भी शरीर में बीमारी है इस वक्त, वो एक एक्सप्रेशन है। शरीर बता रहा है कि ये हम ठीक कर रहे हैं इसको। उसको ठीक होने के लिए मौका देना चाहिए, बस। मौका देते ही वो पूरा ठीक कर देगा। मौका कैसे देते हैं? प्राणायाम करते हैं, ध्यान लगाते हैं, तो इससे क्या हो जाता है, शरीर को मौका मिल जाता है। खुराक तो और नेचुरल खुराक देते रहते हैं। जब ज़रूरत है, जब भूख है, तो ऐसा खुराक देते हैं जिससे कि बीमारी बढ़ेगा नहीं, कम होगा।
गुरुजी लास्ट क्वेश्चन है ये। किसने पूछा है? हेलो, व्हाट मेजर्स टू टेक टू गेट रिड ऑफ एपिलेप्सी ऑल टुगेदर? नीड टू ट्रीट इट फ्रॉम द रूट। आई ऑल्सो वांट टू स्टॉप हाई बीपी मेडिसिन एंड हाउ टू लिव मेडिसिन फ्री लाइफ।
इसमें कोई सवाल नहीं है। मेडिसिन फ्री लाइफ रहना चाहते हैं तो मेडिसिन फ्री कर दीजिए, कोई दवाई मत लीजिए। जो सिम्टम्स आ रहा है वो तो सिम्टम्स अच्छे के लिए आ रहा है। ये इसलिए आ रहा है कि भाई शरीर खुद कोशिश कर रहा है कि गंदगी को हटा दें। उस कोशिश को होने देना चाहिए। एपिलेप्सी आ रहा है, इसका मतलब यह है कि इनका ब्रीदिंग अच्छा नहीं है। तो जब एपिलेप्सी बंद हो जाता है उस वक्त उसके बाद प्राणायाम का अभ्यास करना चाहिए। पैर को हमेशा गर्म रखो, सर को ठंडा रखो, पेट में गीला पट्टी बांधो, और खुराक ऐसे देना जिससे कि और कुदरती नेचुरल फूड मिलता रहे। नेचुरल फूड क्या क्या होता है? जो हरी सब्जियां होते हैं, फल होता है, जो अकेला अलग 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 खा सकते हैं। हरी सब्जियों को तो मिला के खा सकते हैं, लेकिन फल को मिलाकर नहीं खाना चाहिए। एक किस्म का फल एक बार खाना चाहिए। ऐसे कई हेल्थ रूल्स हैं, उनको समझ करके फॉलो करने से धीरे 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 उनका डाइजेशन इम्प्रूव हो जाता है। और जो सटलर फूड्स हैं, जैसे सनलाइट है, हवा है और आकाश तत्व है, इनको समय समय पर देना चाहिए ताकि उनको और भी स्वास्थ्य के लाभ मिले।
गुरुजी लास्ट क्वेश्चन है। इसके बाद अगर किसी को क्वेश्चन पूछना है, and anybody wants to ask question after this question last which I'm going to ask, they can write to mahayoga@99@gmail.com and your questions will be answered there. So the last question is, my wife, 38-year-old, gets a lot of burps even on days when she consumes little food, and it has been for more than 5 years. What can be done? मेरी वाइफ जो 38-year-old है, उनको बहुत ज्यादा डकारें आती हैं इवन दो जब वो कम खाना खाती हैं, और ये चीज 5 साल से चलती आ रही है, तो क्या करना चाहिए?
प्राणायाम, प्राणायाम करने से ये बंद हो जाता है। अच्छी तरह से सांस खींचो और रोक लो। निकालने के बाद जो रोकते हैं उसका समय बढ़ाने के लिए धीरे धीरे कोशिश करना चाहिए। ऐसे करते करते ये डकारें आना बंद हो जाएंगे। डकार क्या होता है? एक एक्सप्रेशन है, जो हवा जो अंदर गंदे हवा है वो अच्छी तरह से निकला नहीं। तो ये कोशिश करने से ये डकारें बंद हो जाएंगे। और अभी जाने से पहले इतना कहना चाहता हूँ सबसे, ये पीरियोडिक मीटिंग्स होना चाहिए और इसमें और लोगों को शामिल करना चाहिए। और इसमें क्या होता है कि ग्रुप बना करके आपस में डिस्कस करो। इवन विदाउट मी, you have to form a group of 9 people। अलग अलग ग्रुप बनाइए और इसके सब्जेक्ट में डिस्कस करिए और उसका जो परिणाम है उसको देखिए और सारे चीज़ को रिकॉर्ड कर लीजिए ताकि उसको रिव्यू कर सकते हैं। 9 का ग्रुप जो है बहुत अच्छा होता है।
Sure. Thanks, Guruji. We have Carol on this Zoom meeting. Gauriji, will you please unmute her so that
Unmuted.
yeah.
I just want to I just want to tell Arun he sounds wonderful. I have missed him so much.
Thank you. It's a pleasure meeting you after a long time.
Yes, yes. Stay healthy and well. Thank you.
Thank you.
Superb to see you. I'm sure Guruji is very happy to have you on the Zoom meeting. So although the questions keep coming and we are not left with any time now, thank you to all those who participated on this call and for all your questions. It was a lovely session. Gauriji, do you want to end this meeting?
I think we've all learned that name of the disease does not matter. What matters is that we have to focus on health. डिजीज के नाम से डरना नहीं चाहिए, फोकस करना चाहिए कि हमको अपना हेल्थ बनाना है और स्वास्थ्य को बड़ा अच्छा करना है. सो बीट एपिलेप्सी, बीट डायबिटीज, बीट शुगर, बीट एनीथिंग, द इम्पॉर्टेंट थिंग इज, जरूरी चीज क्या है कि हमारे जो 5 एलिमेंट्स हैं उन पे हम फोकस करें. सो सन बेदिंग करेंगे, ईथर लेंगे, फास्टिंग करेंगे, ठीक है, और प्राणायाम पे फोकस करेंगे. प्लांट बेस्ड फूड जो हम बहुत सारा मेंशन किया गया है, और जैसे गुरुजी ने बोला है कि फल और सब्जी साथ में मिक्स नहीं करना है, सब्जियों को मिक्स कर सकते हैं, फल अलग से खाना है, ठीक है. फ्रूट्स एंड वेजिटेबल्स शुड नॉट बी मिक्स्ड एंड फ्रूट सेपरेटली शुड बी ईटन, वन टाइप ऑफ फ्रूट एट वंस, राइट. सो इसको हमें फॉलो करना है. लेट्स फॉलो दिस and we'll of course keep having these question and answer sessions again and again. हम ऐसे question answer sessions करते रहेंगे. So until next time, thank you all. Thank you everybody. Thank you Guruji.
Yeah, Vandana,
Inform more people.
you can show details of the camp also again,
Yes.
and also details about the online courses also.
Right. So this is the details of the flyer of the upcoming camp in November.